Good afternoon, dear audience, dear chairmen. I would like to present my PhD projects. Thank you for your participation. I'm Dr. Koppány Kocsis. I'm working as a specialist in Uzsoki Hospital in orthopedic traumatology department. My vision to give a better attendance to our patient with more accurate diagnosis. To gain this aim, my research will be the comparison of the accuracy of ultrasonography and MRI, assessing the injured anterior talofibular ligament and the medial collateral ligament of the knee. My first topic is comparing the diagnostic accuracy of ultrasonography and MRI assessing anterior talofibular ligament of the ankle. This is one of the most frequent injured ligament in the whole body, and the most frequent injured ligament in the ankle. The typical trauma is an inversion mechanism. When somebody step into the hole or step on a rock and suffered supination stress. We have no evidence that the clinical test can evaluate the seriousness of the ligament injury. Nowadays, when we would like to know surely how serious is the injury, we are using MRI. But MRI is hard to available and relative costly diagnostic method, and a lot of patients have wait for long weeks. And we would like to find another diagnostic method, for example, ultrasonography, which is relatively inexpensive, widely available, and fast to diagnose the ligament injury. Yes, our aim is compared to diagnostic accuracy of ultrasonography and MRI. Our clinical question, can ultrasonography quantify the injury of the ATFL compared to MRI? We checked the acute ankle injured patient and compared the sensitivity and specificity results of ultrasonography and MRI. Overview the literature. We found 10 eligible articles which compare the sensitivity and specificity results of MRI and ultrasonography. The sensitivity shows the possibility of finding an injured patient. In the 9 articles, we could examined 367 injured patients and found 352 positive cases with ultrasonography. It's 97%, which is a very high sensitivity in a diagnostic method. The population was homogeneous. The specificity shows the likelihood of finding a healthy patient. In the 9 articles we could examined 152 healthy patients and found 141 negative cases with ultrasonography. It's 93%, which is high sensitivity, high specificity, sorry. This is a common form of visualization of diagnostic tool efficacy. On the vertical pivot is the sensitivity, on the horizontal pivot is 1 minus specificity, as known as false positive rate. As the diagnostic method became better, the summary estimate, marked blue square, it's closer to the upper left corner. The calcaneofibular ligament injury was found in 7 articles beside the ATFL tear. It has a close location to the anterior talofibular ligament, and the mechanism of the injury almost the same. Less frequently injured than the ATFL, but we can visualize pretty good with ultrasonography. From 178 injured patient, 143 was recognized as a positive case with ultrasonography, which means 86%. The specificity of ultrasound examination is better related to CFL. It's 96%. The summary estimate is in the upper left corner too, which shows for CFL is good ultrasonography too. Yeah, in summary, the ATFL and concern to CFL, we saw high sensitivity and high specificity values of ultrasound. In summary, we can say that the strength of our study is the most comprehensive research in this topic. There was no previous meta-analysis which care about only acute cases, only acute adult cases. And the limitations are that there are no RCTs in these topics, and we found only 9 eligible articles, and this is not so high number of studies. In conclusion, I can say that ultrasonography has high specificity and sensitivity concerning ATFL and CFL, therefore may be a good alternative of MRI examination in the diagnostic of lateral ankle ligament injury. It could be primary diagnostic method in the acute cases. An appropriate classification system and practice is required for the examination. Our main aim is to create a dynamical examining method. Later, we can use better patient-specific treatment in case of ankle ligament injured patients. Implication for practice, ultrasonography, it's easy to use, but training is necessary. With ultrasound, we can easily follow up the cases. We can choose those patients who really needs MRI. We could decrease the waiting time for MRI examinations. And we would like to take new guidelines for treatment after the ultrasonography findings. Or implication for research, we can offer the scientists to developing more sophisticated grading system to give better attendance. Our target is a D1 journal, and the article is done. We will send in for internal review. Yeah, my second project is comparing the diagnostic accuracy of ultrasound and MRI assessing in medial collateral ligament injury of the knee in a clinical trial. The medial collateral ligament is the most often injured ligament of the knee. And neither we have evidence that the physical examination can suggest that correct level of the injury. Nowadays we use MRI as a gold standard for diagnose. but we hope so that ultrasound could be a good alternative in this superficial ligament as well. The clinical question is, ultrasound can quantify the grade, the level of the injury. The population is the medial collateral ligament injured patients, and we would like to check the sensitivity and specificity in this trial. I will check the musculoligamentarily matured patients who has knee trauma without cruciate ligament injury, and we will exclude those multiligamentary patients who has a meniscal tear as well, and we exclude the children. At the first patient visit, I will take the X-ray and ultrasonography immediately, and in the same week they injured, I will send them in MRI, and we will compare the results. And we will check the sensitivity and specificity of MRI and ultrasonography. Yeah, I would like to begin after the submission, the second project. Thank you for your time and your attention.
Koppány, just one question to your ankle topic. You told a new guideline will be necessary for the treatment, and that was not completely clear for us. You mean that ultrasound examination must be included into the guideline of the treatment, or the ultrasound examination changes our goals in the treatment?
Yeah.
Should we understand that?
Yeah, thank you for the question. We think that if we can evaluate correctly the in early time the correct grade of ligament injury, we can offer more patient-specific treatment. Nowadays, how it looks like, somebody comes into the emergency department, suffered an inversion trauma, and when it's swollen, it's very painful, and after some physical examination, we can feel some instability. We give them for 6 weeks a cast, but some of patients doesn't need 6 weeks immobilization. For the who has just sprain, it could be enough 1 or 2 weeks immobilization. Who has just partially rupture, we offer 4 weeks immobilization, and who has completely ruptured should take for the whole 6 weeks wear cast. And it would be better if those patients who wear 6 weeks cast and doesn't need so much time immobilization, we would like to care much more about